the organizing committee for this event. I'd like to welcome you all to this panel event titled From Coast to Coast, a National Public Health Student Movement for Palestine. And we're so excited to see so many of you joining us tonight. And so to make sure we stay on time, I'm just going to get started right away. And so for some background, Israeli Apartheid Week this year, observed the entire month of March, is a tool for mobilizing grassroots support on the global level for the Palestinian liberation struggle against Israel's decades-old regime of settler colonialism and apartheid. And so in observance of Anti-Apartheid Month, student groups Radical Public Health, based out of UIC, and NYU Global Public Health for Palestine at NYU, and UC Berkeley Graduate Students for Justice in Palestine, along with a few other co-sponsoring organizations, have united to make this panel happen. And so we're excited to bring together a diverse group of professionals, activists, and students for a dialogue on the ongoing crisis in Gaza and how we as public health students and allies can mobilize to support the Palestinian liberation movement. And we will also be sharing the objectives for this event in the chat for you all to review. And so I'd also like to introduce myself before we get started. My name is Azia, and I'm a second-year MPH student at the University of Illinois, Chicago, concentrating in maternal and child health. And I'm also an organizer and facilitator with Radical Public Health based out of Chicago. And I'll be moderating this panel with support from my colleague, Eglė Malinauskaitė from NYU, who will be leading the Q&A portion of the event. And so before we go any further, I'd like to give the following disclaimer that the organizers and speaker of this event do not represent our respective institutions, and we affirm our right to free speech and stand firmly against censorship and suppression being waged against students, faculty, and other pro-Palestinian advocates on campuses across the US. And some other important information you should know is that we will be recording this event and it'll be posted on the Radical Public Health YouTube channel, and we will be sharing the link to that once it's posted. Please feel free to use the closed captioning if you need it by clicking the CC button on the bottom of your Zoom menu. And lastly, as I mentioned, there will be a facilitated Q&A at the end of this panel. And so please feel free to add questions in the chat as they come up, and we'll have someone keeping track of questions as they come in. Also, we ask that you please share any calls to action that you would like folks to know about and support. And this can include campaigns on your campuses, petitions you like support with, and like any opportunities for people to engage in pro-Palestine activism. And we'll be compiling all of those things into a document and sharing it with our attendees after this event concludes. And so we'd like to encourage connection and discussion in the chat. So if you feel comfortable, we'd love if folks could introduce themselves in the chat and let us know where you're tuning in from. I'm gonna give it a minute here. I want to see who's here. Alrighty, while everyone's introducing themselves, I'm gonna just quickly go over these community guidelines. So to ensure that this is a safe space for connection and discussion, we do ask that everyone adheres to the following guidelines. And please note that we do not tolerate hate speech, Zionist rhetoric, or any kind of harmful language based on someone's racial and ethnic identity, religion, gender, sex, or other characteristics. And we do have a chat moderator who will monitor the chat, and we will issue a warning if anyone uses offensive or inflammatory language, and we will remove people if necessary, if people fail to adhere to these guidelines. So just to kind of ground ourselves before getting into the actual discussion, just kind of want to give an update. I think a lot of us are really connected in social media and like we see these updates, but just kind of want to give a broad overview. So we're in day 173 of this current Israeli attack on Gaza. And according to Al Jazeera, over 32,000 people in Gaza have died and 74,000 have been injured since October 7th. And we know that this is likely an underestimate as there are thousands of people still missing and not accounted for in Gaza. And also, as you guys might know, the UN Security Council passed a resolution for a temporary ceasefire on Monday, but we just want to acknowledge that this is definitely not enough. This is not like I saw this post that was this is not the time to pause our activism. If anything, it's time to like ramp it up just because a temporary ceasefire is really not the solution. And also Ramadan ends in like less than 2 weeks. So this really is not a sustainable solution and definitely not the answer to like decolonizing Palestine and, improving health outcomes for the people living there. Alrighty, and so with that, it's my honor to introduce our panelists for this evening. And so first, I'd like to welcome Dr. Bader El-Ghussein. Dr. Bader El-Ghussein is a Palestinian-American physician activist. He earned his MD at Ross University and currently works as a patient safety and clinical risk management specialist at NYU in New York City. And he's a board member of the Muslim American Society and Islamic Leadership Council of New York. And he has been actively involved in COVID-19 education and community-based outreach throughout the pandemic. And Dr. El-Ghussein and his family are originally from Gaza. So welcome, Dr. El-Ghussein. And next, I'm excited to introduce my radical public health comrade, Eglė Malinauskaitė. Eglė is a disabled, undocuqueer graduate student pursuing an MPH in community and global health at the University of Illinois, Chicago. And they have been organizing since 2014 in movements for immigrant justice, global health, and abolition with a focus on building multiracial and multi-ethnic intergenerational power. Their current political home is Radical Public Health at UIC, and its ongoing campaign to unapologetically support Palestinian liberation from Israel's apartheid and genocide. And as a future global health physician, they're committed to dismantling oppressive systems while building life-affirming and decolonized networks of care. And lastly, our third panelist, Dr. Jess Ghannam. Dr. Ghannam is a clinical professor of psychiatry and global health sciences in the School of Medicine at the University of California, San Francisco. Dr. Ghannam has developed community health clinics in the Middle East that focus on developing community-based treatment programs for families in crisis. And he is also a consultant with the Center for Constitutional Rights, Reprieve, and other international NGOs that work with torture survivors. Locally, he works to promote and enhance the health and wellness of refugee, displaced, and immigrant populations from the Middle East, North Africa, and South Asia, and has established community-based mental health treatment programs to support these communities. And so we are so lucky to be joined by these amazing advocates representing a diverse public health field in the West, East, and Midwest. So really good representation of this event's theme of uniting public health professionals from campuses across the country under the shared goal of Palestinian liberation. So thank you all for joining us tonight. And so to get us started, we have like a few predetermined questions that we're going to ask for about an hour, and then we'll reserve the last 30 minutes for audience Q&A. And so our first question for our panelists is if you could start by sharing as much as you'd like about your positionality and stake in organizing for a liberated Palestine.
You should pick on one of us.
Yeah.
Yeah. Sorry. Okay, we can start with Dr. Ghannam.
Well, first of all, thanks to the organizers for putting this together. This is an incredibly important event, and I'm very, very pleased to be here. I mean, I think positionality is a very important question, and it's good that we're beginning with that. I have multiple positionalities. I'll see if I can describe them briefly. I think first and foremost, as a Palestinian, I have a very deep, committed positionality to Palestinian liberation. And that positionality, and I think if you talk to most Palestinians, we'll all tell you the same thing. That positionality precedes our birth. It follows us out of the womb and tracks us throughout the entirety of our lifespan. So that positionality kind of guides everything that I do, every breath I take, every action I take, every intentional movement I make, both professionally and personally. The other aspect of my positionality is the fact that I've been working in Palestine my whole professional life, and that I've actually been working in Gaza for over 25 years, and have lost many colleagues during the ongoing genocide. And for me, since I have such a strong connection, not just to Palestine, but specifically to Gaza, that positionality has really deeply affected me and continues to affect me. And I think, as many of us know, this didn't start on October 7th, and we'll have some time to get into that, obviously, and especially for Palestinians living in Gaza, the kind of marking, if you will, of like everything happened after October 7th, which is a particular narrative that we hear quite a bit about in the media, doesn't really align with the reality of the occupation, of apartheid, of settler colonialism for Palestinians for the last 75 plus years. The last part of positionality that I'll speak about really has to do with being a professor of psychiatry in academic medicine, which is a complex space to sit in right now, because there's been an absolute, and what I would describe as a catastrophic failure, moral failure, ethical failure of organized medicine and academic medicine in confronting the obvious genocide, attacks on healthcare workers, attacks on physicians, attacks on nurses, attacks on the entire healthcare infrastructure in Gaza, the kind of deafening silence that has been deafening since October 7th and continues to this day, despite whatever political winds may have shifted in the United Nations or with US policy, which, by the way, haven't really changed. So we should be very careful with that hype. But the positionality of being in academic medicine at this particular historical moment, when there's been such a catastrophic failure of organized medicine, of leaders in medicine and in academic medicine to take a principled, moral, and ethical stand against, not just against genocide, but against the murder of healthcare workers and the destruction of healthcare infrastructure, I think will go down in history as one of the most grotesque failures in medicine in the modern era. So that's the brief kind of positionality statement.
Thank you for that. Dr. El-Ghussein, would you like to go next?
Yeah. I mean, same, Dr. Ghannam, I think he reiterated, especially as a Palestinian American, in terms of my positionality. I don't think any Palestinian American, or any Palestinian for that matter, doesn't have a stake in this in terms of what's going on. To add, not to, I think Dr. Ghannam conveyed exactly that position from my standpoint. But for me also to add on to that, having, family in Gaza also is a stake, and knowing especially the places that have been affected in Gaza, the neighborhoods, and I can recollect those areas, and having family that have unfortunately, or fortunately for them, but have been martyred in this. I've had 28 family members since the operations began that were martyred. So definitely there's a stake in there as an activist, in terms of, especially in terms of decolonial struggles and social justice. I have a stake in that. And to add on, as a healthcare professional, as a physician, I think Dr. Ghannam, mentioned it very succinctly in saying, the absolute catastrophic failure of institutions, particularly within academic medicine, and even institutional medicine as well, and even the institutions that we have that have spoken up in times of injustices, and just being absolutely silent, or even just complicit in terms of what's going on now, and not acknowledging the oppression that has been going on well before October 7th, and even well before 1948, even going back to the British Mandate. So, and I think we'll probably touch upon that later, but certainly those are the stakes that I have in terms of positionality. And also, as lastly, but certainly not the least, as a Muslim, certainly this takes a central role for me in terms of advocating for fellow Muslims, but also in terms of advocating for justice for any oppressed peoples.
I can go last. Can everyone hear me? By the way, there might be some background noise. Great. So I'm going to start with the James Baldwin quote that I really resonate with. He said this in 1979, and I resonate with this as, you know, a white immigrant from a country that really considers itself an ally to Israel, especially given Netanyahu's family's direct roots in Lithuania. So the quote is, "But the state of Israel was not created for the salvation of the Jews, it was created for the salvation of Western interests. The Palestinians have been paying for the British colonial policy of divide and rule and for Europe's guilty Christian conscience for more than 30 years. And obviously that was in 79, so it's been far longer since. I want to say that my positionality and my stake is because in fighting for this liberation of Palestinian people is because it's tied into my own liberation as an undocumented person, as a queer person. Especially when I think as a queer person, I see the constant pinkwashing, right, of Israeli apartheid and genocide as the supposed LGBTQ plus haven in the Middle East that I know comes at the expense of queer Palestinians and really queer people around the world. One of my like biggest memories I think of doing organizing was in 2022, witnessing a queer Palestinian friend being violently responded to and arrested at a protest at this was the Chicago Pride protest. There was a Eurovision singer from Israel had been performing, and it was just eye-opening. This was, you know, 2022 before October 7th. And then my stake as an undocumented person, really in organizing for a liberated Palestine, is because I understand that there's kind of an exchange between ICE, Customs and Border Patrol here in the United States, and then Israeli military and police. So much so that I dug into it a little bit because I'd heard this over the course of, you know, my organizing journey. And I was like interested in seeing a little bit more info about it. So apparently, you know, ICE and CBP officials have traveled to Israel. They've kind of gone back and forth on exchanging best practices at like these locations like checkpoints, prison settlements, and airports. And on a similar trip, and I say this because this was actually funded by and supported by JUF, which is, we'll talk a little bit about it more, but it's a Zionist organization which the School of Public Health at UIC currently has a contract with. But during this trip, participants watched a live police exercise with helicopters, force-mounted police, snipers in the K-9 unit, and other resources involved in the monitoring, detaining of cross-border infiltrators. So that's kind of where I come from in terms of my stake. So, and I think really a lot of people who are not Palestinian, who are not, you know, it seems directly impacted, really have to sit with themselves and understand what is my direct stake in this, because really we are all impacted by this. I don't think there's anyone who can scroll through social media and not be impacted by the images that they're seeing coming out of Gaza. So I hope that's brief and explains where I'm coming from, but I'm so excited and honored to be in this space with you all today.
Thank you, Eglė. That all actually like goes perfectly into our next question, which is, what does colonization, or how does colonization manifest itself on your campus or within your academic environment? And you kind of touched on this with our School of Public Health's contract with JUF. So do you want to talk more about that and like how else you see it manifested in our public health curriculum?
Yeah, for sure. So I think it's interesting as public health folks, you know, as a student, you come in and you hear all these narratives around social determinants of health, equity. You know, it's like you're throwing a lot of theory that sounds like when there's real world experiences would be applied to and folks would make the connections. But what I've seen is really, it feels like it's just decolonization and in theory only, and kind of a focus on the academic neutrality and both sides of them. And I think upholding the status quo with this JUF contract is really what I've seen here in Chicago. And more specifically, we've had, you know, Israeli academics actually visiting campus or being given like opportunities to speak about certain issues that they either completely erase Palestinian folks out of. I was in a class where this occurred, or just kind of being put into opportunities to speak to students and really push forward these narratives that go against what we're seeing in real time with the occupation, with the apartheid system. So Yeah, and it's really disheartening to kind of have this kind of back and forth between like what you're learning in class and what you're wanting to see from folks in leadership. So I'll leave it.
Mhm. And I also want to add, just because I feel like we might have been a little vague about what the JUF contract is, but so our school has a contract with the Jewish United Fund where they bring Israeli scholars every year. And in previous years, like they straight up just wouldn't answer questions about Palestine. Like they came to talk about how great the response was in Israel for COVID, but didn't talk about how they withheld vaccines and like they really didn't do anything for Palestinians. So that's where I think our public health the public health students really got involved once that happened. So yeah.
Right.
And
Yeah, I
then,
came in after that COVID
Mhm.
presentation, but then I was in class when we had a scholar come in and talk about I think it was climate change impacts on maternal and child health. And she said, Israel is a child-oriented society. And this was September 21st of 2023 last year. So this was weeks before. And she didn't even say anything about Palestinian folks. There was a student in the class who, you know, even mentioned the occupation, and she just got very defensive and upset and was like, are you asking a question? You know, just kind of like, there was just a certain animosity. I was like, this is absolutely atrocious. And so just seeing, like I said, seeing that in academic spaces and then just the silence after October 7th has been atrocious.
And then Dr. El-Ghussein, can you tell us about how this looks like at NYU or whatever setting you prefer to talk about?
Yeah, it's fine. NYU is perfectly fine. Yeah, similarly with those partnerships as well, NYU has a satellite campus in Tel Aviv, and they have partnerships with Hebrew University. Much of our research faculty is actually um, uh, Israeli origin, so you do see that. So there is a lot of those connections in terms of the academic level, and even to uh, Eglė's point, sorry if I mispronounced your name, but to in terms of the talking about like DEI and all of that stuff, and coming to see like a lot of the Palestinian voices being marginalized or pro-Palestinian voices being marginalized, and it's kind of just we're having a lot of this academic, and pardon my expression for this, academic masturbation in terms of talking about these decolonial theoretical concepts, and yet when it comes to practicing, and when it comes to like things going on the ground, it's like you see the contradictions, and this goes in part to the institutional failures that we've been seeing. One thing I do want to highlight, because I know Dr. Ghannam has like a lot to say on this as well, but in terms of the marginalization of Palestinian narratives, and promotion of biased discourse, like essentially when October 7th first happened, like Palestinians were sidelined from the get-go. And even just the statements of our dean, and many other actually other deans and other NYU campuses just really put Palestinians to the mark until probably I would say maybe 2 or 3 weeks into it. You had some sort of acknowledgement of people being affected like from the pro-Palestinian side, and giving these like overtures of counseling and stuff like that, but it's a little too late. But certainly and even in terms of the attacks on academic freedoms, and also freedom of speech, we've had a lot of our healthcare workers being attacked, even for not even public posts but private posts, and you even have kind of like a network of people that are just reporting frontline staff who are pro-Palestinian and are being punished for voicing those opinions. So it's certainly, you see that um, unfortunately in NYU.
I think what Dr. El-Ghussein said is very, very accurate, and I actually think that it's probably a lot worse than we're able to articulate even. And colonization takes many forms, and it shows itself in many different ways. But I would say at UCSF and globally in the Bay Area in Northern California, that colonization takes the form of an extreme form of PEP, or the Palestinian exception to progressive ideas. So, you know, the Bay Area in San Francisco has a reputation for being very progressive. But what we've seen after October 7th, especially in the healthcare sector and at UCSF and at Stanford and at Berkeley, all the major academic institutions which are very close to each other, is this extreme version of the Palestinian exception to the progressive ideals that people speak about and articulate, as Dr. El-Ghussein says, you know, in these theoretical expositions. But when the rubber hits the road, when the reality of a genocide and the reality of the extension of apartheid and settler colonialism that Israel has engaged in since, you know, before 1948 reaches its kind of ultimate of a genocide of Palestinians in Gaza, we see silence, right? Or even worse than silence. And in some cases, we saw a defense, if people can believe this, an actual defense coming from physicians, coming from academics, especially at UCSF, defending the right of an apartheid state to engage in ethnic cleansing and a genocide, you know, in Palestine. And by the way, not just in Gaza, but also in the West Bank and in Jerusalem. So the extreme form of colonization takes the form of silence in the face of genocide. It takes the form of support for genocidal activities that the apartheid state is engaging in right now. And then at a kind of like microscopic or individual basis, we're seeing things at UCSF, for example, which are extremely troubling when it comes to not just academic freedom, but you know, First Amendment rights to be able to speak one's mind, right? We're seeing faculty and staff and students, our learners, being called into offices and actually being specifically told, you do not talk about Palestine. You cannot talk because it makes people uncomfortable. Now think about that for a minute. We're at an academic institution where ideas sometimes make people uncomfortable. And the idea that we would not speak about something that would make people uncomfortable is an anathema and contradictory to everything we know about academic discourse. And I'll add another level to the healthcare sector. Would we ever, when we teach our residents and our medical students and our healthcare workers about, you know, doctor-patient relationships and how to engage with patients, would we ever say to them, well, we can't talk to our patients about this because it might make them uncomfortable? It's a bizarre idea. And so we see some form of colonization taking the form of a silence and a prohibition, if not outright punishment and attacks on people who do speak. It's even getting so outrageous at UCSF and at other institutions in the Bay Area that people who are wearing the watermelon pins on their white coats, on their lab coats, or are wearing, you know, their kufiyas at work, are being written up, are being counseled, are being told that if they continue to do this, they could very well be fired. Now, mind you, they're wearing Black Lives Matter pins, they're wearing LGBTQ plus pins, they're wearing pins that are advocating for equal anti-racist attitudes towards lots of marginalized communities. Those pins are okay. But when it comes to Palestine, when it comes to Palestinians, when it comes to advocating on behalf of people who are facing this genocide and this ethnic cleansing, there's an attack, not so subtle, by the way. If you're being told that you could be fired if you continue to wear your kufiya, that's very blatant. So that form of colonization is very intense. It has not mitigated at all since October 7th. In fact, I would say in many ways it has gotten worse because we're seeing on the Israeli side, for example, and pro-Israel side of things, that the money coming in to create these programs, what I call programs of silence and attack on Palestinian voices and Palestine solidarity work, have only increased. And I should say, and this is something that I just want to remark a little bit about, that Dr. El-Ghussein said a little bit about. I mean, the idea, and we hear this all the time in organized medicine and academic medicine, it's just so disgusting. We actually heard leadership at UCF said, well, we don't want to take a stand on international affairs. And that is so insulting when we, in fact, have heard these leaders condemn the attack on a Ukrainian hospital that was bombed by Russia, as they should. When that maternal health and L&D hospital was attacked by Russia, we all stood up outraged, as we should. When patients were injured and killed in that attack, we were outraged and condemned it, as we should. And we've done that with similar instances of attacks in clinics and hospitals on a much smaller scale in other marginalized communities in Africa and Central and South America. So the idea somehow that this idea that we would not comment on international affairs is not only bogus, but it's an extreme form of gaslighting. It is extreme form of the Palestinian exception. We can condemn some hospitals, some patients, some physicians being killed, but some, that is Palestinian physicians, patients, hospitals and clinics, when they are destroyed, we have to be silent. So that form of colonization, I would call, the extreme form of PAP, the Palestinian exception to progressive notions. But at another level, it's creating a kind of fear among Palestinian solidarity activists to hold their moral compass, to hold their ethical stance, to be clear and unambiguous about where they stand and how all of these intersectionalities occur. The idea that we would wear an LGBTQ pin and a Black Lives Matter pin, but not be able to wear proudly, our watermelon or Stop Bombing Hospitals pin is completely morally bankrupt and outrageous. And this is this kind of colonization that we have to confront and continue to confront as we go forward, because I'm afraid it's actually going to get worse before it gets better.
Thank you for that. It really just speaks to what I'm hearing from everyone is it's really embedded in our curriculums, in our policies, really, especially in our administrations. I think all of the leadership at all of our universities, and not even just these three universities, I think majority of universities in the US are kind of in a similar position. And so kind of on the flip side, what do you think decolonizing our campuses could look like? And if you know of any current campaigns on your campuses, could you share them with us? And I'd like to start with Dr. Ghannam.
I mean, it's actually hard for on the at least the School of Medicine campuses, but one of a lot of the things that has been working for us here locally, at least on the New York City level, is a lot of coalition building that's happening. And we have healthcare workers for Palestine that's been very active in terms of doing this. And personally, for me, what I've personally contributed to that is we have an anti-retaliation committee where we're going to support a lot of these individuals that are being attacked, whose freedom of expression are being directly attacked on campus, and providing them with the resources they need, be it legal counsel, even in terms of amplifying their voices or amplifying support for them, and directly speaking with those in charge. In terms of really on campus, it's very hard for me to tell, but what we're at least across other campuses, building coalitions is certainly helpful, especially the more voices that you have in this sphere, the more you're able to build momentum and the more pressure you're able to put on the institutional leaderships. That's, I think, one of the things that I think I'm personally working on. Ideally, we would like to see more amplification of Palestinian, pro-Palestinian voices on our campuses, and really holding our leaderships to account. One of the things that we also, I think, have done successfully, and I think this was, early on in the events, we had one of our, I think the director of the Cancer Center here, who was a rabid pro-Zionist, publicly putting hostile posts. We were able to drive a campaign to get him taken down. So that's another thing, that a sphere of or an area where we can actually work on in taking down some of those people that are hindering us. And actually, that person filed a lawsuit against NYU and published some internal emails between leadership, showing the sort of complicity and the sort of biases of our dean of the School of Medicine. So I think calling out those voices, one, defending those that are being attacked, two, and then amplifying the pro-Palestinian voices are certainly steps to be taken in terms of this decolonization on our campuses and coalition building.
Yeah, no, you bring up a good point that it's like we can do small things on like a smaller scale to decolonize our campuses, but I think at the end of the day, it really does need to be this like larger coalition building and like big things like that to really make changes across the country.
Yeah, we're also seeing,
oh, sorry.
sorry to add, but we're also seeing like a lot of pushes to divest from,
Yeah.
Well, yeah,
codes, especially on the.
That's what I was going to say. I mean, there are a lot of national campaigns, because I think you're right. We have to make a national, if not international, campaign to, quote, decolonize, and that includes BDS. That includes, by the way, an organization that I helped found many years ago called the Academic and Cultural Boycott of Israel. So basically, Israel and Israel colleagues and their organized kind of groups here in the U.S. cannot get a free pass. Here in the Bay, again, we have the biotech sector, which is deeply infused with apartheid money and startup money from the apartheid state, from Israel, and that needs to be called out. So a national and global BDS effort that includes the academic and cultural boycott of Israel is one way to begin this larger decolonizing process. And basically, for over 75 years, Israel has been given a pass. They're allowed to engage in ethnic cleansing and provide for this economic engine for itself that promotes ethnic cleansing, but creates this economic wealth for the colonized community, for the community and power there. That they get the free pass. They get the free pass here in the United States. They get organizations, many of whom that are in New York. Unfortunately, Dr. Hussein, where they where they raise money to support settlements, illegal colonial settlements in the West Bank and in Jerusalem, and they get a free pass. They get a 501c3 tax deferred organization to promote that. So we need to call it out. They cannot get a pass. We need to not just amplify, but publicly shame these organizations that are in collusion with apartheid. And we have to do it loudly, and we have to do it vigorously, because there can be no free pass for genocide and for apartheid. And let me just throw something else in. The intersectionality is a great idea, because our allies are standing with us, and we need to protect them, and they need to have our backs. But when we do our teach-ins, which is another way to decolonize, obviously, when we do our teach-ins here at UCSF, we invite all of our communities to participate, to show that intersectionality. And that's been an amazing process. Well, whether it's been the API community, the Sawana communities, the LGBTQ plus communities. I mean, the intersectionality with Palestine solidarity has been impressive, and I think needs to be celebrated very loudly. And that's another form of the decolonizing process. Sorry to jump in there, but you can see I have a few things. No, you can see I have a few things to say. Sorry about that.
No, I think you two are touching on everything that I had in my mind kind of floating around. I want to say, I think the importance on coalition building is so necessary, because what I've seen at UIC for a while was, because we have, some physical distance between the East Campus, where a lot of organizing with like our SJP chapter happens with undergrads, because we have such a large Palestinian student body, we've had this kind of structured kind of siloing of like, they're doing their thing on the East Campus, we're doing our thing with the School of Public Health and Medicine on West Campus. And really what I've realized I had to do as a student was really like, I want to build those relationships, kind of bridge those gaps. And a lot of this relational building has really gotten, I think, us understanding how there's overlap in not just our individual campus work, but just the entire U of I system in terms of divestment. So, you know, there's multiple campuses in the U of I system around Illinois. I think UIC, we've just been so focused on divestment from the lens of like weapons manufacturers. We also have other student groups like dissenters who are on board, Students for Democratic Society. We've had different coalitions like mentioned around like healthcare workers for Palestine. We have tech workers for Palestine. We have cultural workers for Palestine. So many different groups in Chicago that I know we can kind of build relationships with, lots of signal groups to jump onto. But, you know, when those relationships happen, like they're really necessary and important because then you build those kind of intersectional dialogues. I also wanted to uplift, we have faculty for justice in Palestine and Jewish faculty for Palestine, which is really exciting.
Yeah.
Folks leading sessions about how this is really, you know, you say it again and again, but you really have to stress the point, anti-Zionism is not anti-Semitism. Like, and having those really tough conversations that, you know, between community members is really important. But yeah, I think divestment is a really big thing that I think of as a continuation of student-led divestment campaigns that I've been a student of in some way, learning of what's happened, you know, to end the South African apartheid. Like what lessons can we take from that too, to apply to this kind of moving forward. So yeah, just to echo what everyone's already been saying, but I think decolonization, like we know it's not a metaphor, it's constant acts and pushing and unlearning things and building momentum and agitating bravely.
Yeah, I like that. I just want to really amplify that, but also get us all to have a much broader view of what it means to decolonize, right? I mean, there's the physical aspect of decolonizing and calling out these relationships that our campuses and universities have with illegal settlements or companies that operate in illegal settlements or companies that benefit from apartheid and ethnic cleansing. That's the physicality part of it. But we also have to remember the mental, psychological, cognitive elements of decolonizing. And that's more difficult. That's more intense. That takes more time, where we want to help our allies understand that the fear and anxiety that they have about speaking truth to power, about organizing, about being in solidarity with Palestine is that mental colonization part that we have to confront vigorously and uphold the values that we believe in speaking that kind of truth to power and condemning, you know, righteously, you know, the kind of brutality that Israel has been engaging with for the last 75 years that has only been exacerbated since October 7th. So I just, you know, that work, it's tough work, but, you know, I just want to make sure we don't forget about the mental parts of how people get colonized.
That's why these teachings are so important, because I think that's part of that key driver for that.
Definitely. And I think the mental decolonization needs to happen before we decolonize everything else. So that's a good point. So building, like, when we're doing all of this work, obviously, I think we've seen in schools across the nation, like a lot of students and faculty are like being retaliated against. Like I can speak to at UIC, there has been a lot of retaliation against our specific student group at the School of Public Health. And at UMich, I know there's a lot of stuff going on there. Columbia, like literally almost, I'd say like a majority of schools, there's a lot of this going on. And so how do you recommend like students navigate dialogues about Palestine, or like how do you think we can like better navigate these retaliations, I guess? Or like, yeah.
I can jump in because or go ahead.
I'll just really quickly say, I think what we've seen with RPH and just USC in general is like, we need to document everything, emails, kind of just keep like a rough list of receipts. And I think I really want to be in a position where we can have these things documented, but then shared publicly and like kind of disseminated and see like, look, this is what you're seeing, because this is affecting our entire student body. You know, they'll get emails about listserv changes or, you know, this and that and be confused. But I think we ultimately, if we present it and bring it to the light, I think that helps. I'm sure someone in the panel is also going to mention Palestine Legal. I think they're a great resource as well.
Right.
To lean on. But yeah, I just kind of document and share and disseminate and push back. That's kind of my focus.
Yeah, and I would add to that, like, you know, educated, if maybe in your localities can have like, you know, what we did in New York City is had like an anti-retaliation committee that's dedicated to focusing on this. And one of the things that we've done, I mean, something that's happened post October 7th is that you had a lot of within the community know your rights campaigns, but they were kind of general or, you know, specific to activists or protesters. We actually did one specific to healthcare worker and those within academic environments and how to navigate that. And we've partnered with the National Lawyers Guild. You know, we have, you know, they're a great resource. I know Paralegal is also a great resource, but I know they're also oversaturated or overworked at this time. But certainly getting, you know, and there are legal voices out there that, you know, are willing to do stuff pro bono and are willing to especially at least educate people on the ground in terms of what their rights are and how to fight back. And to Egle's point in terms of documenting, yeah, that's the key thing. Just like for the providers out there, documenting is very important, even when it comes to this advocating for Palestine it's very key. And also not to be afraid to document, you know, the sort of pro-Israeli, anti-Palestinian voices as well, and call them out. I think there's a hesitancy within the pro-Palestinian activist space to actually report people. So we've been, you know, like advocating or telling our comrades and community members, don't be afraid. Take a screenshot of those things, because they're actually taking screenshots of our comrades and private accounts and sharing it with their with our leadership. So might as well do the same thing. So don't be afraid to do that as well. And that's something we've hit to the point, and that actually kind of shows the double standard of an institution. For example, at NYU, this kind of happened where in the beginning phases they were targeting specifically pro-Palestinian voices, but then when you saw sort of the pro-Zionist voices being like their screenshots being taken and sent to the leadership, they kind of had to like counter that narrative as well. So it does help. So definitely, you know, knowledge in terms of know your rights, education on that stuff. Develop anti-retaliation committees in your state, in your areas, because that, you know, and pull your resources together, especially when it comes to the legal aspects and HR aspects, or registrar, academic, administration aspects.
Yeah, that's all really good stuff. That's really good. I'll just kind of echo and amplify a few things. So the organizations that I think we need to really rely on, obviously Paralegal, but yeah, they're pretty swamped right now. The ACLU is starting to step up a little bit, especially on the free speech elements of it. Let's not forget our colleagues at the Center for Constitutional Rights who have been very actively involved in this, and they're in New York, man. So, you know, don't forget about CCR. NLG is great, and then CARE. You know, we shouldn't lose sight of CARE because it's a great organization that has chapters all over the United States. I want to just kind of talk a little bit about the importance of the documentation part, which both of you spoke about. It's really key because,
and then together with
the reason that's really important. I'll give you a real life example. We had a colleague, a nurse, who was, you know, wearing a keffiyeh and told, you can't wear that or you're going to get counseled. And she asked specifically to see in writing the specific dress code violations that she was violating, and they refused to give it to her because there wasn't one. So they use this kind of verbal intimidation without backing it up. And so if you're fearful, you might hear that verbal warning from a supervisor or manager and take off your keffiyeh or your pin or whatever and just go along with it. But if you're part of your own decolonizing process, not fearful and willing to say, show me the data, show me the policy, which doesn't exist, then you can push back, in that way. The other thing that I would say is that we've had a number of people who've been called in for, to their supervisors for verbal warnings. You should never do that without going in with somebody with you, take a witness, because it's a very different dynamic when they have, 2 or 3 against 1. There's no eyewitnesses. Always take a witness with you. So I think these are really good pieces of advice that are coming from all of us. One last thing really quick is that we have actually done what Dr. El-Ghussein said. We've taken these screenshots of faculty members at UCSF Zionist faculty who've posted the most vile things on X, basically calling for, removing all Palestinians from historic Palestine. I mean, really vile stuff. We screenshot it. We sent it to our Office of Anti-Harassment and Anti-Discrimination. We made multiple complaints. It's a national and statewide legal mandate, and this person is getting written up. So these kinds of formal strategies, which we as Palestinians and pro-Palestine solidarity activists, we typically haven't taken advantage of. They do exist. Take advantage of them and push, push, push.
I just do want to add one thing in terms of the policies and stuff like that. One of the things that I have noticed also is some institutions have pivoted and changed their policies. So it's something also to be aware of in terms of your specific institutions, but certainly pointing out those like areas where are those policy breaches that happened is a key thing, and definitely taking somebody as a witness, or like legal counsel specifically, that would be best. And so a lot of the institutions allow that to happen. So
let me give you an example of that. So we at UCSF, everybody wears, the pride pins, LGBTQ plus pins, the BLM pins, and it's now the green pin, exactly. And now we're wearing the watermelon pins and being told we can't wear them. So we're pushing the university in a corner saying, well, if we can't wear this one, are you saying we can't wear BLM? We can't wear, and they're really freaking out about that. And that's exactly the position, that's the PEP position that we want to put every organization in. If you're saying we can't wear a Palestine pin, then you're saying we can't wear BLM or API or whatever. And for them to go on that kind of right-wing extremist kind of reactionary format kind of contradicts all of the DEI work and pseudo-progressiveness that a lot of organizations espouse. If you look at the shiny brochures that all of our universities, the kind of colorful rainbow brochures, which are painfully performative to see. But anyways, when we call them out on this, it forces them to a reckoning that, and at UCSF at least, they've backed off. But who is to say that this won't get pushed even further? I mean, this is happening, as we know, at a time when the reactionary right wing wants to dismantle all of the DEI work that we've been doing for decades within medicine and in the academy. And they're using this as an opportunity to dismantle it. So again, we have to push back.
Yeah, the DEI points are also interesting because we talk a lot about at UIC, like this is such a diverse campus, but it's like you want all this diversity, but you're not respecting your diverse students. So
some diversity. They don't want
we
all
want some
diversity.
diversity, but not too much. But anyway.
Not too much. We want some. We want palatable diversity. We want
just something for the brochures.
Just something for the brochures, man. That's really what they want.
For the campus photographers to take a picture of.
That's really what it is. That's really, I mean, we're joking about it, but that's the reality. Yeah. The nice rainbow brochures that we have at UCSF, it's really bogus when you look at what's happening at campuses now in this attempt to really silence, brown and black people and solidarity activists in Palestine. It's, and again, this is part of our own decolonizing, where we have to call it, we have to name it, we have to call it out, we have to confront it and not be silent about it. That's really what this is about.
And so I think something that I think about a lot is that in medicine and in public health, we're in spaces where people are supposed to care about like genocide, ethnic cleansing, just like, in general, like you would think people who believe in health equity for everyone would automatically support Gaza, but they don't. And
Almost
so,
everybody. Just
yeah,
not everybody, almost everybody.
yeah, health equity for some people, but anyways.
That's the pin I want to wear. Health equity for some. And underneath, except Palestinians. No, health equity for everybody, and then underneath in parentheses, except
Yeah.
Palestinians.
Very fine. Yeah.
Yeah, fine
Yeah.
print with a little like asterisk, so you have to read the fine print. I mean, we joke about it, but I would love to make a pin like that,
Yeah.
honestly, and just kind of call out the hypocrisy. And it's not even a double standard; it's a quadruple standard. So, but this is why, we have to push, because we just even talking about it, we could see how outrageous it is.
Definitely. I want to thank you all for your sharing your experiences up to this point, and to close us off with the predetermined questions, we'd just like to briefly hear from everyone about how you think public health students, faculty, and all public health practitioners can leverage their skills and knowledge to advocate for Palestine and to continue to build momentum in this movement. Because as we know, this is just the beginning. We are nowhere near the peak of this movement. I think we're just getting started. And maybe we can start with Agda.
Yeah. Well, I keep getting emails that National Public Health Week is coming up. So I don't see any speakers speaking about what's currently happening in Gaza and the West Bank. And I think we are in a position to really make Palestine a litmus test for people in our fields, right? And to make it something that we talk about intersectionality, but really, it really is at the intersection of so many issues. I know that in UIC we had questions about why, are we talking about maternal child health in relation to the genocide? Are we not clear that there are people having C-sections without anesthesia? Are we clear? Are we not seeing things intersecting right before our eyes? So I think as people in these fields, we really have to ask if the conversation is and do the work to incorporate it. And then I think the really big focus that I really appreciate in this conversation about decolonizing our minds really is constantly sharing these resources and this information, because for a lot of people who are kind of new to this, I think their memory is October 7th onwards. And I think the more kind of literature and the more just research that we can find and share is just going to help continue kind of doing a lot of that unlearning that we have to do in the process of working towards liberation. So I hope that's clear in how I explain.
Yeah, I mean, just to not repeat everything that Eglė said, that I think is actually very good. I think also just centering the Palestinian voices as well in this areas, amplifying them in these spaces is key moving forward. Especially and the intersectionality piece is very important across sectors. I think sometimes what happens to us, especially in healthcare, we get siloed into just the healthcare space. But if we're drawing it with connecting the Palestinian cause to the labor cause to other causes, that's also very, very important. When you're getting also, especially if you're part of unions, professional spaces or whatever, and getting them involved and voicing or rather like addressing the consequences of occupation and what's going on in Palestine now in those spaces, like it's key. And that's one of the things that we saw, like, in the anti-apartheid movement for South Africa, as well as in the Vietnam era, where you had, mass mobilization of labor unions and professional civil society going in at this and advocating for their causes. I think similarly, we need to be doing the same thing in public.
Yeah, yeah, I think both of those comments are really spot on. I like the concept of the litmus test. I really do. Even though sometimes that connotation, people may have a strong reaction to. But what's wrong with having a litmus test that says, if you're committed to DEI, if you're committed to justice, if you're committed to a true understanding of, let's say, the social determinants of health, is not apartheid a negative social determinant of health? Is not ethnic cleansing a negative social determinant of health? Is not settler colonialism a negative social determinant of health? To just like call people out, not, as I said before, not to give a pass, a free ride to the PEP kind of siloing that goes on in public health and in medicine. It's just, that's not acceptable. And I know what we're doing at UCSF is like what a lot of the students are doing, and not just in medicine, but in nursing and in pharmacy and in the graduate division. They're insisting that that in the curriculum committees that things are going to get totally reorganized to make sure that we can talk about what are the health consequences of genocide, that be specifically part of the curriculum. And why is it not? Because we always talk about the social determinants of health, but it's a very limited social determinant. So it's organized by the way power wants us to organize it. And we have to take ownership over the curriculum committees at all of our institutions and hold them accountable. So, I would just throw that out there because that's really a critical point, because I think we're seeing this generational shift now. And, as Eglė said, that, that, even if the fighting stops, there's a ceasefire today, the devastation in Palestine is going to be generational. This is going to have a multi-generational impact on our communities. And, I know what the pro-Israel groups are hoping. Well, they'll get the ceasefire, everybody will go away, we'll have this nice, quiet, slow-moving ethnic cleansing and genocide, and people won't pay attention. We have to resist that. We have to fight against that. We have to create a long-term strategy to make sure that this particular social determinant of health, the settler colonial project, and its logical consequence, which is genocide, by the way, has to be called out, and we have to evaluate that as we would anything else in public health or in academic medicine, right? We have to look at this, and that's what I'm pushing for.
Yeah, I really resonate with what you said about siloed work, I think, in this field, because we're really trying to like overcome that at UIC right now. We noticed that like the medical students are doing their own thing, we're doing our own thing. And we like just recently got in touch with medical, nursing, dental students, and we're like, hey guys, we need to start organizing together because
Right.
we're really not getting anything
Yeah.
done when we're doing things in such small groups. So no, that's super important on campuses, I think. And also with the settler colonial determinants of health, we are going to include a resource about that and Eglė fell off. Hopefully they'll come back. But yeah, we will have a resource about the settler colonial determinants of health if anyone's interested, and that'll be shared like at the end of the session. And so thank you all for sharing your knowledge and your insights with us. And this discussion has been really great, but we're gonna shift to the Q&A portion for the audience. And so I'm gonna pass it over to Eglė now.
Thank you so much, Izzy, and thank you so much to our panelists. This teaching was really informative. So we're going to start off with one question that we had in the chat, and then I'm going to invite everyone who has any more questions to just raise their hand and they can ask them once they unmute themselves. So The first question has to do with medical field. So as a graduating medical student, I see my peers in action on this topic, and I hate to say that I fear for their patients' well-being when faced with political hardships, which I think will be a regular part of our future in medicine. Do you feel that the passivity of medical students and physicians and inability to take a political stance can potentially put patients at risk?
That's such a good question. Of course, it puts patients at risk. My God, it, I mean, this is part of, I mean, and again, this is what I talk about to residents and medical students almost every day, is that you can't silo yourself off from reality and think that that's not going to have an impact on your patients. I mean, what's interesting is that that siloing, that shutting down, that kind of what I would call one-dimensional way of engaging with your patient is harmful to the patient. We know that. We know that from all of the work that we've done on the social determinants of health. And so healthcare workers, physicians, nurses, whatever your specialty is, you as a human being have to be dimensional. You dimensionalize yourself and dimensionalize your relationship to your patient, because it's not just the patient, it's the patient's family, it's the patient's community, it's the patient's history, it's your community, and that all intersects in that sacred space in the exam room, in the hospital room, when you're sitting there or standing there and engaging with your patient. So without going through the entire class that we teach on this, it's such a good question, because I think it completely kind of should help all of us understand how we engage and approach all of our patients. Because, I mean, let's just look at African American maternal health. Decades of work on it, decades of funding, decades of research, and we see literally no impact on mortality and morbidity for African American women in terms of maternal and child health. Hello? What, isn't something really catastrophically wrong with that? Yes, of course. So that means we have to reconfigure, rethink how we approach the bedside or the clinic and how we engage with our patients. And just a couple of small anecdotes. I mean, I've had so many residents and attendings tell me when they've worn their watermelon pin, in with a patient, and the patient breaks down in tears and says, I can't tell you how that makes me feel so amazing and connected to you to understand that you're wearing that pin. And it created an opening to engage with the patient in ways that they had never, done before. Oh, hi, Miss Jones. What's your 3 complaints today? Let's look at your vitals, and we're done. But engaging with the patient in a way can dimensionalize your relationship with the patient and will put you in a much better position to treat them 100%. That's the short version, by the way. So sorry about that. Well, Bader, what do you think about that? What's your take?
Oh no, I mean 100% agree. I mean, like again, for physicians, people in the healthcare, like as healers, you have to. I mean, even the way we started this event, the teaching, articulating our positionality. I mean, that's the key to approaching medicine and you're healing people. So there has to be a space for it. I think this sort of idea of medical neutrality is such a farce, in my opinion. When talking about like these types of things, you cannot be silent about these topics. You have to address them, and especially when dealing with because also that's patient might be going through the same thing and need to it's
Absolutely.
part of the empathetic process.
I mean, can you really imagine having a Palestinian patient come into your office and not saying anything to that patient,
Yeah.
to that person about what's happening?
Yeah.
And that happens every day. Look at that empathic breach that that empathic misalignment,
I mean,
that it would just be a profound empathic failure. And I would say the same thing to our LGBTQ plus folks, to our African American community folks who come in as patients,
Yeah.
to not speak to the obvious reality of something about what they're bringing into the room is a complete failure of empathy with that patient. Come on. So why is it any different with our Palestinian or Muslim or Middle Eastern, North African, Sawana, Solidarity? I mean, why is it any different? Well, it's not unless you believe in PEP, right? Because it's no different.
I do want to add on, I think one of the issues also, one of my many critiques of medicine now is that it's become so depersonalized and so technical that, that's why we've seen a lot of these failures in medicine, especially here in the States. So I think that's why it's even more of an importance to have that positionality as you're approaching your patients.
100%.
Sorry for losing connection. I was able to jump back on. But yeah, I mean, I'm in a position where I know I'll be pursuing medical school, and as someone who, just knows that I'll be in positions working with patients who, positionality is so important, but they're coming to you more often than not at their most vulnerable. And it's like, if you, it's like you mentioned, Dr. Ghannam, like, if you're not addressing the lived reality of what's going on, it's just, you're doing a disservice to them, and you're really going to miss a big picture of what their healthcare needs are. So yeah, I wanted to lift that up. I think I'm in a position where it's kind of still before the storm of medical school, but I have stories, so many stories from my colleagues who are already in school or in residency, who are just hearing some things from their colleagues that are, if not outright Zionist talking points, or just, erasing the lived experience of Palestinians. I think they're in a position to be like, well, I worry what you will do then as a physician once you have your license. So I get into that space of like, I don't know if I would trust like my body or the body of other people who I know are impacted directly or indirectly by the genocide, in the hands of folks in medicine who are just, if not erasing what's happening, or supporting. I don't know. That's kind of the headspace that I'm in.
But Eglė, let's be real. Medicine doesn't have a good history when it comes to horrific things that it's done to marginalized communities.
Oh, for sure. No, for sure.
I mean, the track record is pretty bad, and you don't. It's a recent history. It's not that long ago. I mean, and I don't want to do a history of like all the horrific things that have been done in the name of medicine, but this is something that really needs to be taken on directly. And we say this a lot, but it may be that Palestinians and our struggle is going to save freedom and justice, and may save medicine, to help reorient medicine to the reality of what it means to be in a room with a patient, genuinely, empathically, intentionally, in that sacred healing space again. 32,000 Palestinians have been murdered in Gaza, and their and the memory of their devastating murder may be really instrumental in helping us right the ship of that, as Dr. El-Ghussein said about the depersonalization that has happening in medicine right now. This kind of, okay, what are your three complaints today? And I have to tell residents, don't look at the computer when you're sitting with the patient. Can you believe we're saying that? Yeah, you should look at your patient. I feel like I'm such an OG, man. It's it's like, come on. It's yeah, you can shake your patient's hand. That's
Yeah.
okay. You can look them in the eye. You can ask a personal question. You know, it's we got to get back to that, really. But you don't want me to talk about that because I'll be talking about that forever. I know we have a ton of questions.
Thank
Just
you.
going just going back to the chat here, we have a couple more questions. When pushing for structural change at universities and speaking specifically at UIC, I know our PH and professors have gotten pushback that talking about the genocide in Palestine, releasing statements on the genocide, etc., have made some Jewish faculty, staff, students feel unsafe. I feel like the safety of these Jewish staff, faculty, students is consistently prioritized. How would you recommend pushing back on this because it feels like a non-starter for admin due to safety concerns?
Well, not talking about genocide makes me feel unsafe.
So, yeah.
Not ignoring a genocide makes me feel erased, makes me feel unsafe. And this kind of narrative, you know, if it makes you feel unsafe, then you don't have to listen. If you don't want to hear about genocide, leave the room. And I say that all the time if I'm giving a lecture or speaking about this. If you don't want to confront this genocide, if it makes you feel unsafe, then leave. I don't have any problem with that. Because guess what, everybody? Genocide is uncomfortable to talk about. And I think it's even more freaking uncomfortable for the people in Gaza who are being starved to death, who literally children are dying from famine in the 21st century. You have almost 100 Palestinian children in Gaza who literally are dying because they don't have enough calories. So if that makes you feel unsafe, then you can leave. And I don't have any problem with that because it's not about creating safety for a supremacist class. It's really not. It's about creating an environment where we can talk about uncomfortable topics in a rigorous way. And if they want to sit and listen to it, and if they want to advocate for genocide, you know what I tell them? Bring it on. Let's talk about it. You want to advocate, and I mean, you know, 100 Israeli physicians did write a letter
Yeah.
basically saying it's justified to bomb hospitals. Okay, bring them in a room. I'm ready to take on that discussion anytime, any day. So yeah, that's what I say. I mean, we have to remember that we're talking about discourse. And, you know, this is not about threatening people or criticizing people. It's about criticizing ideas and criticizing actions. And I have no problem criticizing apartheid, settler colonialism, or genocide. And I think we as healthcare workers have to take that on and not feel intimidated about the threat that somehow some people are not feeling safe. Really, then leave. I'm sorry I don't sound very empathic right there, but
It just, I don't know, in my mind, I'll be honest, it sounds like white fragility. like,
it is white
it's
fragility.
just,
It is. Yeah.
you sit there and you're like, I'm sorry, your feelings are hurt. We released a statement and, you know, I think this is why it's important then what we're experiencing at UIC, you know, I'm having dialogue with anti-Zionist Jewish folks, and they're like, these folks don't represent me. Like, I want to speak out. I want to also say, like, I feel fine. I'm not like there's genocide going on. Obviously, the safety of a person in that scenario is of more importance than my feelings right now. So I don't know. It's white fragility in my mind, and I think more people need to call it out.
Right on, white fragility. But can I name it even further? White Zionist fragility.
Yeah.
I mean, just to be real about it.
Absolutely.
For sure. I think this next question kind of plays into that as well. So I'm going to ask that, and then once you guys have answered, we'll ask people to unmute and ask any questions that they may have. But how do we push back effectively in the workplace against the assumption that all Jewish folks are Zionist? The demographic game is often played where they say we don't want to make our Jewish colleagues upset, but this assumes that all Jewish folks are the same, which I find to be an anti-Semitic idea, or at the very least, a generalization. How do we engage this at work where they barely know what Zionism is?
Go ahead, you guys. I've been taking a lot of these. You guys go.
I mean, the thing is, for me, growing up, I had a lot of Jewish friends. Most of my Jewish friends were anti-Zionist, so it's for me, it's just like the conflation of the two is I mean, fairly recent. To be quite honest, that there's a rich tradition of anti-Zionism within the Jewish tradition. So, yeah, I don't know. I don't know how to like it's yeah, I don't know how to can you restate that question, the last part of the question again?
Yeah, absolutely. How do we engage this at work where they barely know what Zionism is?
You
And
just bring
Yeah,
anti-Zionist Jewish people to meetings.
voices. Yeah, exactly.
I mean, we had a meeting with campus leadership. We brought, 5 anti-Zionist members of the Jewish community, and the leadership was freaked out because this was a Palestine meeting and we brought 5 people from the Jewish community. And they said in front of our campus leadership, we are Jewish. We condemn the genocide. Blah, blah, blah. That shut it down. And by the way,
I mean, for the
there's a large number of anti-Zionist Jews.
yeah, I mean, for the New Yorkers here, like most of our disruptions were by JBP and if not now folks. So it's like there's a pool to choose from here.
Yeah, I just want to uplift what was mentioned in the chat too. We did try to have a meeting with our dean and the anti-Zionist faculty and a student or two, and then they refused to meet. They said we want I'm trying to remember what they exactly said. Like they want to do an in-person meeting when not all of us could, meet in person. We preferred like a Zoom option for accessibility, and then they stopped replying.
Cowards.
so just being mindful of time, there are a few people who have questions here. So we'll wrap up with these 2 questions and then we can go back to Izzy for just some wrap up notes. But Cheryl, if you want to unmute yourself and ask your question.
Hi, I'm really thankful for this presentation. I'm at UIC. I really liked early when you guys were talking about decolonizing like your own brain and like fighting, I guess, that self-censorship. We put together a panel, which the College of Medicine refused to let us put out over the listserv, and so we had to do through our networks. And we had a big struggle in that group about what to like. Should we just talk about medical stuff, or should we add in some history? Because otherwise, how could you even understand what's going on without the history part? And we had a big fight among us. Some people thought we should only talk about the medical sort of tragedies that were happening and like kind of leave history and politics out of it. We didn't go that way, and I'm really glad we didn't, because I think it would have been sort of like a lie of omission or something. It wouldn't have been the best panel that it could have been. And we were very intentional trying to have like men and women on the panel, Jewish and Muslim speakers on the panel. So anyway, but one of the questions I had is like one of our speakers kept saying, this is an American genocide. It's being funded with American tax dollars. If Americans hold back their financial and military support, it would end right away. It's an American genocide. And it made me think about how we like the whole start of it being a British imperial project, and like now it's a US imperial project. And I hear us talking a lot about settler colonialism, but have you guys tried talking about imperialism? How does that come across? Do you think that that element is part of what makes this more challenging or dangerous to talk about?
That's a great question. It's the same. I mean, imperialism is just turbocharged settler colonialism. That's all it is. I mean, imperialism is going beyond national boundaries and getting power at a turbocharged transnational basis to steal people's resources, dispossess people, and engage in a form of genocide. I don't have any problem talking about it. I think it's good to talk about that in the larger context. And I mean, I say it all the time. This is an American genocide. Does anyone really believe, without the full-throated support of the United States, the executive branch and the Congress, that this genocide wouldn't go as far and deep as it has? Of course, there's no question about it. And I'm sorry to keep saying this. Don't believe the hype coming from the State Department or the White House that, oh, Biden is wringing his hands. There's this tension with Netanyahu. That is such profound BS. There's no change in U.S. policy. Palestinians are getting murdered every day. Bombs are still being sent. Ethnic cleansing is occurring in the West Bank. So please don't believe that BS coming from the White House.
Yeah, I mean,
I just, sorry, go ahead.
go ahead.
I'll just make one point. One of the resources we have in the document we'll share at the end is a map of all manufacturing companies, and I think there's just so many conflicts that they are involved in.
Right.
I think the latest was 69% of arms to Israel come from the United States. Obviously, that's not 100%. There are other countries that are involved. If folks look into like PAL Action, there are like direct action organizations that are doing amazing work to, to confront these very agents of imperialism in terms of the weapons manufacturing.
Yeah, I mean, also like empire is part of the problem across the world, so it's not unique to Palestine. So where you look
Right.
at it, it's empire has its reaches everywhere, and the U.S. is no exception to that. I mean, if you look at DRC, for example, there's
Right.
Issues there, and empire has its reach there too. So definitely centralizing empire in these discussions, or incorporating empire or imperialism into these discussions, is certainly apt.
It's just that Palestine is at the center of that anti-imperialist fight. That's the
Correct.
difference.
That's the only difference. Yeah.
That's a big difference. We're at the center of the fight against imperialism, and that's why that's why they're coming hard, by the way, if you want to have another analysis about it.
Right, Sarah, do you want to unmute and ask your question?
Sure. First of all, thanks for doing this. And Dr. Ghannam, I emailed you recently, and I appreciate you getting back to me, but it's been nice hearing your opinion on this stuff recently. I appreciate that you're candid about it. I wanted to go back to the anti-Zionist Jewish conversation and white fragility and everything. So I'm a student at Quinnipiac in Connecticut, but I went to a speech at Yale earlier with Peter Beinart, who's the editor of Jewish
Right.
Current magazines.
Yeah.
Jewish Currents magazine, and I was discussing kind of a point that I think there is that conflation of Zionism and Judaism, because all of the organized Jewish groups in the United States are Zionist organizations. However, there are, millions of Jews that don't associate themselves with these organizations anymore because they don't think that represents their Judaism. So, there are millions of anti-Zionist Jews, but it's not, noted in the polls that we see. So there is kind of that deliberate conflation of Zionism and Judaism, because if you're only polling people, at the campus Hillel or Chabad or something, then you're not going to hear the voices of everyone else who's speaking up. So I'm glad that this conversation is kind of coming to the forefront, and people are organizing and talking to people of different backgrounds, and Jewish people are talking to Palestinians, and there's finally a conversation that seems to be having some momentum now.
Hey, thanks, Sarah. By the way, Jewish people and Palestinians have been talking forever. It's
Yeah.
just no one has been paying attention.
Paying attention. Yeah.
No one pays attention. We've been talking for a long time,
Yeah.
but no one's cared or paid attention to it. So, but yeah,
Thank you.
thank you.
All right, well, with that, thank you so much for this dialogue. It was very informative and very interesting to hear. Bring it back to Izzy for the final wrap up. Perfect.
Righty. Thank you so much, Ellie, for facilitating that discussion. And so to wrap up, I just want to give huge thank you to our panelists on behalf of all of the organizers of this event and also everyone tuning in from all parts of the country. I know this is a super busy part of the semester, so thank you for making the time to be here today. And we really appreciate all of you giving your important time to us, and we thank you all for the important work you're doing for public health and for the Palestinian cause. And also just huge round of applause and appreciation for all of the organizers and sponsors of this event that you can see on the screen. This event really could not have happened without the contributions of all of these public health students and organizers. And yeah, we put in a lot of effort to make this happen. So thank you to everyone who was involved in the planning process. And lastly, just thank you once again. And so we have this QR code on the screen to where you can like see our resources, calls to action, and ways to stay engaged in pro-Palestinian activism and public health. And also, if you would like to add any action items to this, because obviously it's not exhaustive, please just email me. My email's on this slide. I'll probably send a follow-up email after. And yeah, we can add any action items specific to your school or just general action items you want to uplift to people. And yeah, so go ahead, scan the QR code, take a picture, do whatever you need to do. And we look forward to connecting with you all after this event, and we'll be reaching out with the recording and everything we've mentioned tonight. So thank you and have a good evening, everyone.
Thanks, everybody.
See ya.
Bye, everybody.
Thank you. Thank you.